Nowadays, we look up at social media, TV, or in our locality. Everyone is talking about novel coronavirus or COVID 19. Everyone knows that the most affected country by the novel coronavirus is China. But in this video, we are going to discuss about China's neighbor country, South Korea, because South Korea is now one of the most affected country after China and Iran in Asia. So let's start about how novel coronavirus is spread in South Korea. There are two reasons how it is spread in South Korea and we are going to look up them in detail in this video. Number 1. Shincheonji Church. So let's first talk about Shincheonji's theology. Shincheonji teaches illness is a sin, encouraging its followers to suffer through diseases to attend services in which they sit closely together, breathing in spittle as they repeatedly amen in unison. The net effect is that Shincheonji followers infect each other easily, then go on to infect the community at large. According to many reporters, and Korea Center for Diseases Control and Prevention said that patient number 31 and few other followers were infected with COVID-19 in first instance. South Korean authorities investigate that these members, including patient number 31, attended the funeral of brother of Shincheonji's founder held in early February. Shincheonji has 19 churches in China, including in Wuhan, and it may be possible that followers from Korea attended the funeral. Infected Shincheonji member then spread coronavirus by sharing closed office spaces, refusing to be quarantined, and hiding their membership. All through patient number 31 ran a high fever. She attended 2 Shincheonji services which held more than 1,000 worshippers each, in addition to attending a wedding and a conference for a pyramid scheme. She visited a clinic after being involved in a minor traffic accident, but ignored the repeated recommendation by the doctor to receive testing for COVID-19. In other case, a self-identified Shincheonji follower who came to hospital complaining of high fever ran off during examination when the doctor informed her she may be quarantined. One woman who donated her liver to her mother for transplant delay admitted she belongs to Shincheonji when her fever would not drop after surgery. Both cases led to temporary shutdown to the hospitals involved, making the health response to the coronavirus that much more difficult. In a trigonomic instance, one of the Daegu city officials in charge of infectious diseases control was revealed to be Shincheonji follower. Only after diagnosis confirmed he was infected with coronavirus. Since the discovery of patient number 31, the number of COVID-19 cases in South Korea jumped from 30 to 9,000 in less than a month. Nearly all of the new cases are Shincheonji's follower or traceable to them. Particularly tragic is the case of Chengdu Daenim Hospital, where the funeral for Lee Man-hee's brother was held. The hospital alone saw 134 cases, most of whom were long-term psychiatric patients. Because these patients never left the hospital, much less travel abroad, they were not tested early for coronavirus nor were they properly quarantined. This led to an advanced stage of the diseases among many of psychiatric patients, resulting in 7 out of 12 coronavirus deaths thus far. Later, South Korea seeks criminal charges against Lee Man-hee, head of Shincheonji Church, for alleged role in spreading COVID-19. Number 2. Negligence of South Korea's government with COVID-19. On January 26, 3 days after China's lockdown on Wuhan, the Korean Medical Association, the country's largest association of doctors, urged the government to temporarily ban entry to all the travelers arriving from mainland China. But Moon's government did not heed that warning. Instead, it donated 1.5 million face masks to China. Moon's defender point out that the World Health Organization does not recommend a travel ban for virus prevention. At a time, there were 70,000 people coming from China per day, and this causes a huge problem. The foremost priority for any infectious diseases is to stop contagion, and the most basic solution in this case was restriction. 4 days later, on January 30, the WHO declared global health emergency, and many countries like US, Australia placed a temporary ban on travelers from China. Later, more than 80 nations have imposed a temporary ban, but Moon declined to impose a full travel ban. I think because China is South Korea's largest trading partner and Chinese make up about half of the 17 million tourists who visit the country annually. On February 4th, 5 days after WHO declared an emergency, South Korea enacted a limited ban which banned entry by any foreigner who had visited China's Hubei province in previous 2 weeks. On February 13th, as the official count of infection in China approached 60,000, a week later on February 20, in a 30-minute phone call with Xi Jinping, Moon pledged South Korea's unending support for China's fight against the coronavirus, saying that China's difficulties are our difficulties. That same day, Moon and his wife hosted a party for Oscar-winning film Parasite. By that afternoon, the number of infections in South Korea had doubled from 51 to 104, and the first COVID-19 related death in the country was reported. Within 36 hours, 8 more Koreans died from virus and the number of infections grew up to more than 800. On February 23rd, Moon finally raised the coronavirus alert to the highest level and declared a voluntary lockdown of affected cities and provinces, but the virus has already spread across the country. Now more than 9,000 cases and 81 deaths in South Korea has been recorded. So these are the reasons how coronavirus is spread in South Korea. So in the end of the video, I want to say that please be conscious from the rumors spreading in social media, and the only key of safety in your hand. By seeing this picture, you will understand what I want to say. Thanks for watching this video, hope you enjoyed it. If you enjoyed this video, don't forget to give us like. And please comment on which topic should I ask to make the next video on.